Okay, so before we actually start talking about what a discectomy is, the disc comes from the cushion between your spinal bones, and ectomy is Greek for removal. Sometimes you'll see this word written down with a C, and that would be the English way. That would be the American English way of writing it. Sometimes you see it with a K, and that's the British way of spelling it. Just so you know, they mean the exact same thing. It's really just the traditions of the language that they came from. A discectomy is a back surgery where a surgeon takes out a piece of either slip disc or damaged disc that's pressing on the nerve and causing pain. Now, what am I talking about when it comes to discs? I'm going to use my happy little model here, and this is what I mean. So this is the spine vertebrae that are in your, spine. And between them are little cushions, and these cushions are the intervertebral discs, or in this case, we'll just call them discs. I know on this model, they kind of look like marshmallows, but they're not. So there's a whole nother anatomy to them. I won't go into that right now. So right now we're just focused on the discectomy. So these little marshmallow things are between your discs and they act as a cushion. So you can see when I push down, this is exactly how it works. So imagine yourself with sneakers. If you're a runner, eventually you have to replace those sneakers because there's no cushion left. You wore them down. This also happens as you age, as these discs, they get worn down and get smushy. And sometimes that causes these discs to either bulge out or they smoosh down. And in the back of your spine is your spinal cord, of course. But between these little pieces of your spine, you have bits of nerve root and nerves. So what happens is that when these discs decide to slip or they herniate or they bulge, it can actually cause pressing on your nerves there, and that causes the back pain. It causes back pain, it'll cause tingling, it'll cause weakness, either going through your shoulders if it's further up your spine, or down your leg if it's further down your spine. So what happens with a discectomy is that the surgeon will actually go in there and remove whatever part is pushing on that nerve, causing you pain or discomfort. So a discectomy can either be performed on its own or in addition to some other procedures. For a standalone procedure, you have a lumbar discectomy, and this classic operation is for a herniated disc in your lower back. Fun fact, this little model is actually your lumbar spine. Yours might be a little bit bigger than this or smaller than this. I'm not going to judge you. A microdiscectomy, the most common version done today, is done through a small incision with a microscope to remove the disc fragment. And lastly, an endoscopic discectomy, which is even less invasive, using a camera and tiny instruments through a tube. The whole idea is that surgery has been leaning away from procedures that are more open and you gotta fiddle through the bits and pieces inside the body, let's just call them that, over to minimally invasive. And the point of the minimally invasive is to have smaller incisions, there's less moving around going on inside your body, which, as you can imagine, the less moving and rearranging around, the better for your body. And depending on the surgeon and depending on you particularly, the surgeon will make the decision how they want to approach. So just know that that is a clinical decision I can't help you with. But again, these surgeons go to school for many, many, many years to know how to approach not only the procedure the way it is, but what's best for you as the patient. When you combine with other spine surgeries, you have a laminectomy with discectomy, where the surgeon removes part of the bone and the disc fragment to give you more nerve room. A discectomy with fusion is when the damaged disc is removed and the space is reinforced by fusing the two joints together. So sometimes it's with screws or with rods. And the whole idea of fusing something together is really just when you have two or more bones in your spine that are, quote, welded together so they heal into one solid piece. And lastly, artificial disc replacement, or ADR, in which case instead of fusing, the surgeon removes the bad discs and replaces it with something that's man-made. I think disc replacements are really cool. I like the way that they move closer to what the natural body actually does. As I said before, your surgeon will make the best decision for you. When a simple discectomy is all they want to do, so standalone, normally they'll stick to just removing the bad piece of disc when only one disc fragment is the problem. The spine is otherwise stable. So kind of like Jenga, where you can actually remove one of the pieces and it stays in place, that means it's stable. Where the pain is mostly leg pain, like the nerve pressure, not significant ongoing back pain, you don't have any disc collapses, so these guys aren't actually going like, and then it's the first surgery at that level and you have no prior operations. And the whole idea behind this is to relieve the nerve pressure without changing the structure of the spine. Now, when they add fusion, as I mentioned before, this is when you bring multiple bones together and make them one. So there could be instability in the spine. Again, think of it like Jenga. If you're pulling it out and you see that tower start to wobble, that's instability. So in the spine, that's not what we want. So if there's instability in the spine, the surgeon will couple this with fusion. If the disc space has collapsed and it causes chronic back pain. So as I mentioned, in this case, you have this nice, tall, healthy disc and you go, and that causes a bunch of pressure in the back of your spine. So again, think of it as, this is your spine normally, this is your spine when the discs collapse. When the discs collapse, that throws off any sort of equilibrium you have within your back. Sometimes it can cause pain. Some people actually can be okay if they have herniated discs, slip discs, so on and so forth. So the main point of this procedure is to remove and address the pain. They'll add fusion when there's previous discectomy at the same spot. So let's say that you had a prior surgery to this, or there are multiple levels that need to be treated. The whole goal of fusion is to stabilize the spine to stop painful movement once the bad disc is gone. When they decide to choose disc replacement. So again, this is a surgery where a worn out or damaged disc in your spine is taken out and replaced with a man-made one. It's like replacing a bad cushion in your spine with a new one that still lets things move. And this may be an option when the pain is mostly disc pain from one badly damaged disc, so not like widespread arthritis. The patient is relatively young, active, and healthy. This is also the case for a lot of military. And then the last is there's no significant instability, deformity, or nerve compression that requires fusion. So this spine is more stable than you would have for a fusion, but then a little less stable than if you just did a discectomy. The whole goal is to remove the bad disc, but keep that level moving instead of locking it in place. So in short, just a regular discectomy is best for nerve pain from a herniated disc. Discectomy plus fusion is best if the spine is unstable or painful even without nerve compression. And then discectomy plus replacement is best if the disc itself is the pain source, but the spine is otherwise stable. If you found this helpful, be sure to follow, subscribe, or share with a friend. Thanks for learning, and I'll see you next time. Spine, 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 spine. Go in the spine time, go in the spine time. Spine time, go in the spine time. Time for the spine, it's time for the spine, it's time for the spine, let's go.